on here because you can't be in this situation and know everything that you know and behave this way and pretend that everything is okay.
You heard?
I wonder what's going on here because you can't be in this situation and know everything that you know and behave this way and pretend that everything is okay.
You heard the White House Chief of Staff Mark Meadows tell Jake Tapper that the U.S. isn't going to control the pandemic. Do you believe others at the White House share that approach, the approach expressed by Mark Meadows?
I do. I think that you're watching the White House double down and just say, you know, we have not wanted to deal with it. We said it was the state's problem to deal with, even though we're going to pressure them to open up way too soon. And we know that it's going to get really bad in the winter. That's happening right now. It's playing out exactly how we all knew this was going to play out. And I think what they've decided is, you know, COVID is a reality that they don't want to face. This has been a failure. And they're just not going to talk about it now. And they'll just pretend that it's just not happening and move on and hope that they get reelected. And I really just think that that will be a very, very bad circumstance for all of us if they do get reelected, because you're going to watch them just keep on moving on while the rest of us suffer.
Olivia Troy, thanks so much for joining us. Good luck to you. Good luck to your family in El Paso as well. Thanks very much for joining us.
Thank you.
Let's turn to our medical experts right now. Dr. Ashish Jha is joining us, the Dean at the Brown University School of Health, and Dr. Celine Gonder, a CNN medical analyst, former Assistant Commissioner of Health for New York City. Doctors, the Vice President, Mike Pence, he's in charge of the U.S. efforts against coronavirus, yet he's refusing right now to quarantine, continues to be out there campaigning. Here's how Chief of Staff Mark Meadows responded to a question about that. Listen.
And I can tell you that what he's doing is wearing a mask, socially distancing, and when he goes up to speak, he will take the mask off, put it back on. But he's wearing a mask as it relates to this particular thing because the doctors have advised him to do that.
So, Dr. Jha, aren't these just the things that the Centers for Disease Control and Prevention have been telling all of us to do, whether or not we've been exposed or not?
Yeah, Wolf, thank you for having me on. They are. It's kind of nice to see the Vice President doing them. But at this moment, that's not what he should be doing. He needs to be in quarantine. The evidence on this is overwhelmingly clear. And there are some very specific exceptions for when you can break quarantine. He doesn't meet any of them, not for rallies. And so I'm glad to see him wearing a mask and social distancing, as all of us are. But he still needs to be back in quarantine right now.
So you think he should be, Dr. Jha, quarantined for 14 days right now, given the close proximity he was to these 5 associates of his?
Yeah, look, the CDC guidelines on this are very clear. There's no exception for campaign rallies. There's no exception. The only time you have an exception is when when you have to do something for critical infrastructure or needs of the country. Nobody thinks that campaign rallies would meet that. He is the Vice President. So you could make a case that he has important duties. I suspect he can do most of them from his home while he's quarantining.
What do you think, Dr. Gonder?
Yeah, I would agree with Dr. Jha that this is a situation where he clearly should be in quarantine for 14 days. I do think, it is stepping back concerning that this is the White House's second outbreak in the last month. Are they going to be doing contact tracing and testing? We know that they did not do so for the Rose Garden event. We did observe, many of us, that the Vice President had conjunctivitis, which is a pink eye, which is a known symptom of coronavirus at the vice presidential debates. Could he have been the source for his AIDS infections? And how seriously is the White House taking this risk to their own staff? If they can't get their own house in order, how can we expect them to protect the public's health? So big picture, it's not just about whether the vice president should be in quarantine. It's the entire White House strategy with regard to the pandemic.
Dr. Jha, we've gotten news tonight that Dr. Scott Gottlieb, the former commissioner of the FDA, now says it's time to consider a limited and temporary national mask mandate. He wrote about it in an op-ed in the Wall Street Journal. Do you believe he's right?
I do believe Dr. Gottlieb is right. Dr. Gottlieb's been very measured about this. As you might remember, he was the FDA commissioner for President Trump in the first 2 years of the Trump administration, Dr. Gottlieb, has been, I think, thoughtful and balanced. And at this point, given how bad a situation our nation is in, a mask mandate feels to me like the bare minimum that we could be doing.
And what do you think, Dr. Gondry?
I absolutely think that this is time for a mask mandate. You know, in America, we talk a lot about personal responsibility, but the fact is we have not taken personal responsibility and worn masks to protect ourselves and others. This winter is unfortunately going to be quite bad. It could well be worse than the spring and summer months were. We've already seen transmission spread from younger groups to older Americans, and now we're setting record-breaking highs in terms of new cases. Hospitalizations are up 40%. So I think we're looking at a very tough coming months.
You know, Dr. Jha, let's talk a little bit about some of the things that have happened today. For example, the president working a rope line in Maine, getting very, very close to fist bump his supporters out there here in Washington. Hundreds gathered on the National Mall for a Let Us Worship prayer rally. One of the organizers tweeting, it's not about protesting COVID, it's about worshiping Jesus. All of this as we see case counts higher than ever before here in the United States. When people reject science for expressing, let's say, political or religious beliefs, how do you react at a time when there are record numbers of new cases here in the U.S. on Friday and Saturday?
Yeah, Wolf, it's distressing because there is absolutely no contradiction between being a religious person and protecting human life. And in fact, most religious leaders at this moment are calling for more action to protect human lives. And yet, I think we've managed to somehow turn this into a political issue, that if you believe in protecting human lives from COVID, that somehow you're politically on one side of the aisle. It's a very unfortunate situation for our nation to be in. We can come around and really rally around the idea that we have to protect people, reduce the number of infections, and get through this time period before vaccines become available widely next year.
You know, Dr. Gondry, it's so sad when you think about this, controlling the virus. In late January, both the United States and South Korea had their first confirmed coronavirus cases. In February, around almost exactly the same time, the United States and South Korea had the first confirmed deaths. Right now, if you take a look, as far as deaths are concerned, the United States has had more than 225,000 confirmed deaths over these months since February and March. 225,000 confirmed deaths. South Korea, a country of some 55 million people, has had fewer than 500 confirmed deaths. 225,000 confirmed deaths versus under 500 confirmed deaths. They've controlled the virus. The United States has failed to control the virus. Why?
Look, we haven't learned. We haven't learned from our experience. We haven't been committed to mask wearing and social distancing, contact tracing and testing, which are the proven public health measures to control this. And frankly, things are looking pretty bleak right now. In Utah, hospitals are looking at having to ration access to ICUs and ventilators now. As we heard earlier in El Paso, in some cases, hospitals are having to fly or looking at having to fly patients to other hospitals in the state. The governor is asking for permission to use a military hospital near El Paso because hospitals are overwhelmed. And frankly, some of the worst hit places in the country right now are rural areas, and those health facilities are very quick to be overrun. So this is really going to be a very, very difficult couple months ahead.
It certainly is. And Dr. Jha, very quickly, what did South Korea do right and we did wrong?
Well, they jumped on this early, they took it seriously, and they built a fabulous testing and tracing infrastructure. We still can do all of that. We just aren't making the investments to do it.
It is so, so sad indeed. All right, Dr. Jha, thank you so much. Dr. Gondry, thanks to you as well. Meanwhile, Senate Republicans are planning to hold a confirmation vote for the U.S. Supreme Court nominee Amy Coney Barrett, and Vice President Pence actually plans to preside in the U.S. Senate. But now the Senate Minority Leader Chuck Schumer is sounding the alarm. Senator Tammy Baldwin is standing by live. We'll discuss when we come back.